and then I'll unmute you. Okay. So thanks to all of you for joining this meeting, and I hope you're all doing well. Spring is right around the corner, I hope. Okay, so a question. I think, Renee, you have your hand up. You have to unmute.
We just had 20 inches of snowfall here, so spring better be around the corner.
Yeah. I was visiting my grandkids in Pittsburgh, and the place we're staying there had 1 foot of water in the basement. There's massive flooding.
Oh,
1 foot of water.
wow.
Okay, Jennifer, do you have a question? I'm going to unmute you. You have to unmute yourself. I think you're still muted.
Yeah, am I unmuted now?
Yep, I can hear you
Okay.
fine.
All right. So before I started the program with you, I took supplements on a fairly regular basis that contain things such as zinc and quercetin and NAC. And now I'm taking the Ocufolin and using the Total Ocular Function Spray, which also contain some of those ingredients. And I want to know if there is an amount I should not go above with some of those supplements. You know, if I need to cut back on some of my supplements because yours have some of those ingredients.
Yeah, I would definitely cut back. And I think it's probably not necessary. I have found that the Ocufolin is probably the best nutritional product that I have seen. And there's been some studies done to show that it actually reverses retinal pathology just as a standalone product.
Mm-hmm.
And I feel that one of the problems that many people, the mistake they make is they take too many supplements.
Right.
There was an interesting study done, you're not going to believe this, that people that take vitamin supplements have a lower life expectancy.
Oh, interesting.
Now,
Yeah.
it could be that when you're sick, you have a tendency to take more vitamins. You know, if you're really healthy, you just don't take vitamins. So the study does have some questions, but I know for a fact that so many of the supplements out there are contaminated with heavy metals and synthetic products. And I'm a firm believer that food is our best medicine.
Right.
You know, if God wanted us to take vitamins, he would grow them on trees.
Right.
So I really think that you have to look at your diet. And as I mentioned before, that macular degeneration did not exist before 1920. And it has to do with changes in our diet, particularly seed oils.
Mm-hmm. So there is one supplement I take that has other things in it which could help control allergic symptoms. It also has a little quercetin. I don't know that it has zinc. Well, you know, I'll ask you next time since I don't have it in front of me and I don't know the amounts, but
Well, I
I'd
think,
like to be able to
you know,
take
if
that
you're
one.
taking, if you're taking something for other health issues,
Uh-huh.
like allergies or women's
Right.
health or men's health, you can continue those. But I really don't think it's necessary to take additional supplements for your eye.
Oh, no, I was taking them for immune support in general and then allergy, you know.
Yeah, I think that would be all right because quercetin is really good for allergic problems.
Okay, so I can't have too much. That was my concern, too much quercetin.
Well, you can always, you can always have too much.
Okay.
Even water, if you drink too much water, it can be
Right.
detrimental to you. So I think you just have to listen to your body.
Okay. Thank you.
Because a lot depends. I mean, you could be taking like 1,000 grams of so just because you ingest it doesn't mean that all of it gets into your body.
Right.
If that makes sense. So you have to listen to your body in terms of symptoms, your overall energy, how you feel.
All right. Thank you.
Okay, let's see here. Camilla, I see your hand up. Are you unmuted?
Okay, now can you hear me?
Yep, I hear you.
Okay, on that microcurrent machine, how many of those programs is it good to run like every day?
Well, I recommend that you should probably run your eye program every day. That's the most
Yeah.
important.
Okay,
The second most important is the stress program,
okay. Yeah, and there's
and
sometimes,
then the brain and sensory.
okay. Okay, I was just wondering if maybe I was running too many of them per day or how many you would recommend running
Well,
like every day.
if you have the time, you could run all of them.
All 5 of them that you,
Because well, you could even run all 10 every day if you have the time.
yeah,
Because
that's amazing.
you're putting electrons into your body, which is
Yeah,
beneficial. But the
yeah,
main thing is to listen to your body, because if you're running a lot of microcurrent and you're not properly hydrated, you may get some symptoms, flu symptoms. You may not feel well. So you really have to listen to your body.
okay,
Oh, and
okay,
I'm just to make a comment. I'm doing a lot of research about the brain
yeah,
and memory, because a lot of us, including me, are getting older,
yeah,
and we want to protect our brain and vision. And there's some really interesting studies about the hippocampus, how important it is for memory. And I looked at the memory program that we have, and I don't have any frequencies for the hippocampus. So I'm going to be redoing brain and sensory program. I'm always trying to update things.
yeah. So then
So
when you
I'll
do
keep,
that, how do we get it put into our machine to update the
well, I'll
machine?
make an announcement.
Okay,
But before I make it routine, I'm going to have to do some experimentation to make sure it doesn't have any side effects.
okay,
So my wife isn't here. I'll probably treat her first.
okay.
And
She's your guinea pig.
if she starts to listen to me, then I know it's a good program.
You know it's working. Yeah.
I know
Okay.
it's
And
working.
on my last appointment that I had with you, there was a dental appointment pending, and that was supposed to have been April 5th. Well, it was moved up to March 27th. And the permanent crown then will be put on the 30th of April, and you were wanting to wait till all that was done before you had another appointment with me.
Right.
So,
Yeah, because there's probably going to be an energy shift in your body.
okay. Yeah, and since I've had that done, I've been running the detox program quite a
Good.
bit because of the
Yeah.
glue and crud they put in there to glue that cap on. And
Mhm. Yeah,
there was a little bit of decay, but not as much as what they thought there might be. So that was good. So he didn't have to build the tooth up with anything, so there was no extra material put in there, which was good. But anyway, you
Well,
would still would want,
let's wait till after the dental procedure, probably a week or so, and then we'll touch base, and maybe
okay,
we'll update things for you.
okay, I'll let Chris know when, like maybe 2 weeks after that.
2 weeks. Yep, I think that'll be sufficient.
Okay, all right. I think that's all I
Okay.
had.
Okay. Well, good luck. Okay, Vivian, how are you? You have to unmute.
There. I have
Okay,
two
good. I can hear
questions.
you.
Good. As far as supplements, is there a brand that you think is better, fewer toxins in the supplement? I take CoQ10 because I'm on statins, and D3, B12 because metformin sucks B12 out of your body. And I did see one bottle I bought made in China, so I stopped taking it because I don't trust
Yeah.
their standards. But is there a brand that you like that you think is more wholesome if you have some you have to take for good reason?
That's a good question. I'll have to do some research on that. email me what you're taking and I'll take a look at it.
Okay, thank you. Then I have another question about macular degeneration. I have a friend who has lost central vision in both eyes, has macular degeneration, and has been on the injections for a while. And her doctor said that they were at the limit of what they could do with the injections. And she's trying to keep her peripheral vision. And is there anything that in your protocols that could help her maintain the peripheral vision, given that she's already lost the middle part of her vision?
Well, my goal would be to help her to restore some of her central vision, and it can be done. But the most important thing in terms of macular degeneration treatment is changing your diet, avoiding the seed oils, and avoiding anything that has a label on it. Don't eat it. The other thing is I like the ocufolin.
Ocufolin?
That's a good nutritional supplement that we recommend. And of course, also, the light therapy and the microcurrent. I'd be happy to take a look at our records and see if she's a candidate for the program.
Okay, I'll talk to her, have her send them to Chris. She
Yeah.
lost the fluid in her eye with her macular degeneration. So I don't know if that means what that means, if it's still something that can be helped.
Yeah, I'd have to take a look at our records because I don't understand her losing the fluid, what that means.
Okay. All
I'd have
right.
to take a look at her records.
Do you have a meeting for potential new people next week? Are you still doing the new?
Yeah, I'm hopefully I'll do it next week. You
And
can get
what
that
time?
information from Chris.
Okay, because maybe if she could come and have a chance to talk to you and ask questions, it'd be helpful.
Yeah, that
Okay.
would be that's at 4 p.m. I think it's usually the second Saturday, but Chris can give you information on that.
Okay. Thank you.
Okay, thank you. Okay, Renee, hi. You have to unmute.
Hi, just a quick question. One of my extra protocols on the microcurrent is arthritis, and I chose that specifically for my neck. Where would you suggest, I have both gloves and the pads. Where would you suggest I place like the pads to cover the neck thoroughly?
I would say on the left side of your neck and the right side.
Okay.
And then just draw an imaginary line. Draw an imaginary line between the pads, so that line goes right through the neck, the cervical column.
I was thinking vertical, where would I put them? So I wasn't thinking side to side, so good to
I
know.
wouldn't recommend putting it up top because those frequencies are going to go through your brain.
Okay. Thank
So I
you.
would just do the side by side. I think you'll get a better effect.
Okay.
Okay. Lois, I think your hand's up. I wasn't sure if you wanted to ask a question or you're demonstrating how to use the microcurrent pad on your hand. You have to unmute.
I have a question.
Okay, there I am. Hi, doctor. I have a bunch of questions. Number one, unfortunately, I saw my my retina specialist physician assistant on Thursday, and my left eye, which actually is my amblyopic eye that has bad vision, but I still use it. I have a horseshoe-shaped tear, and I have a hemorrhage, and both eyes now have pigmentation along with the drusen and the geographic atrophy. So the physician's assistant was there by herself, so they had wanted to do laser, but she's not allowed to do it if he's not there. So I will be going back next Thursday, April 11th, for the doctor to do the laser surgery on the retinal tear. And Chris had I had called and asked her about using the microcurrent. You said it's okay that I use the microcurrent right up until I have the laser done. But then that, like the evening after I have the surgery. They told me, I guess the tear, it's not central, it's more on the edge of my retina. And they don't think I'll have a bandage or anything. So will it be okay to start the microcurrent up again right after
I think you should probably wait 1 day.
wait 1 day? Okay, all right. And then like the same with the Aquamed drops and all of that as well.
You could probably take the drops. The drops wouldn't be a problem.
Okay, okay. And then I do have to schedule a consult with you, but I'm trying to, get the information from the clinic. And in the past, they've always given me the option of, on the form, it says to email it or fax it. Well, even when I request email, they always fax it to you. Of course, faxing doesn't help with the pictures, the images. And then finally, when I was there this past Thursday, they told me that they don't do email, they only do faxing. So I did take screenshots with my iPhone. So in the past, I've emailed those to you and Chris. So should I just do that with these as well?
Yeah, that would be good, because if you take a picture with your iPhone, we get a nice color copy and I
Yeah.
can see all the details.
Okay, all right, all right. And then I did get new glasses, which you had suggested the last time I spoke with you. But unfortunately, my vision is now 20/50 and it was 20/30 earlier this year. So, it's kind of disconcerting. I'm feeling I'm trying to follow the program as much as I can, but, I'm feeling a little bit discouraged because, I had been doing fairly well and now things are kind of, getting off kilter again. But then, and we need to, I need to, like I said, schedule a consult with you to.
Yeah, I need to take a look at your records. We may have to update some things in your program.
Right. Okay. All right. All right. And so so probably like after next week, after I get everything emailed to you and all that, then we can set up that appointment. Okay. My other question is, since my eyesight is getting worse, it's getting harder for me, like, to read. And so I'm reading more like on my iPad and computer because I can make it bigger and the light is better. Is that, and I'm also sometimes, I'll watch a movie in the evening on my iPad, and I do have, blue blocking in my glasses for them. And I have the filters on my phone and my iPad, but is it too damaging if I'm spending, more time, looking at screens?
Well, I'm happy to hear you're using the blue blockers. That helps protect your eyes at night. And I would really recommend
blue blocker. I have
that
no
you
idea
limit
Remember, I
your
gave
time.
it to you.
Okay. All right. All right. Okay.
Okay.
Because,
I'll
my
get it again.
doctors always say, oh, well, they don't think, they don't really believe.
Oh, I had to mute you, Lois. I had to mute everybody because there was some background noise from somebody. So you have to unmute yourself.
Okay. Is that better? Can
Yes,
you hear me now?
For those of you that join, make sure you put the mute button on, because otherwise I was hearing some talking in the background.
Yeah.
And I think somebody was in the kitchen.
Oh, okay. Yeah, I could hear it too. And my other question is too, I did get, in terms of the eclipse on Sunday or on Monday, like I'm in Northeast Ohio, and so it's going, right over us. And, I did get the glasses, the special glasses and everything. Is it okay for us to go out and look, or would it be better if we stayed inside?
I think it would be better to watch it on TV.
Okay.
You don't want to take a risk, especially if you have macular degeneration. I mean,
Right,
it's really
okay.
not that great. You'll get a better view on TV.
Yeah, okay. Okay. All right. All right. Thank you, doctor.
Okay, well, thank you. And I'll look forward to talking to you once we get the records. Okay.
Okay, thanks.
Okay, Julia, hi.
Hi, doctor. My question is about the EDTA. Since the last meeting, I started taking it. And initially, I began using the dosage recommendation on the bottle. And that was 1 pill 3 times a day on an empty stomach. And I did not feel well when I did that. Similar to when I did the the urine test for heavy metals.
Mhm.
And I didn't feel well for about a week and a half after I did the test. And of course, I understand why. I wanted to ask you how you take it, or if you have a recommendation for me, because I don't want to take it 3 times a day on an empty stomach. What would you suggest?
But what I do is I take 2 capsules in the morning and 2 capsules at night on an empty stomach. I have an
Okay.
ironclad stomach. It doesn't bother me. The key is you want to make sure you drink plenty of water when you take it. And I would recommend, if you are having some symptoms, maybe start out with just 1 capsule a day.
Okay, I can do that. It wasn't so much a stomach upset. It was just a general sense of feeling lousy, So
Yeah. Well, I
have
think
a
it's you're
feeling
probably dehydrated. You definitely have to drink a lot more water.
really. Okay.
Yeah, because those toxins are being released in your body, and you need the water to flush them out of your body. And also, I would recommend doing the detox program. That will help the body's process in eliminating those toxins.
So you're referring to the suppositories?
I'm referring to the detox program, the detox microcurrent program.
Oh, yes. Okay. I'll do that more often. Now I'm drinking between 60 and 70 ounces of water a day. So you want me to up that?
Well, you should be drinking half your body weight in ounces. So
Okay,
I'm not
I
going to
know.
ask your weight. I'm not going to ask your weight at this meeting.
Thank you. I am doing that now.
Okay.
Yeah.
But you may need a little bit more water, or you may want to time it closer to when you take the capsule.
Okay. And I'm currently in Arizona, so I definitely need more water here, I've noticed. All right, so I'll start with 1 capsule a day on an empty stomach. I'll increase my water a little bit, and then I'll go up to 2.
Yeah, and if you're
Okay.
living in Arizona, the hot weather's coming, and you probably definitely need to drink more water,
Yeah,
especially if you
I'll be
spend a
back
lot of
in
time
Ohio.
outdoors.
Yeah, I'll be back in Ohio then before all
Mhm.
that starts. So another month and I'll be there. So, okay. Well, very good. I'll take your recommendation.
Okay, keep us
Okay.
posted.
Okay.
Okay, Bonnie, I see your hand. Hi.
Hi.
You have to unmute. You have to unmute, Bonnie. Oh, you're still muted.
Now can you hear me?
Yep, now I hear you fine.
Okay. On this microcurrent machine, I have the one with 10 numbers, and it
Yes.
has a plus and a minus on it. And I reached into my apron pocket here to pull it out once, and I hit something there. I think I accidentally hit either the plus or the minus, but I don't know if that is a problem. If I did, and when I turn it off, would it go back to its normal programming, or what's the
Yeah, you
story?
would, those plus and minus, some doctors enable patients to increase the current or decrease the current.
Yeah.
I'm not an advocate of that because I want to keep the current constant.
Uh-huh.
So those are not in operation on your machine. So
Oh,
even
they're
if you
not.
do hit the plus button or the minus, it's
They
not
don't do
in
it.
operation.
Oh, that's good to know. Another thing is about consumerlab.com. If I want to take a supplement, I always check consumerlab.com because they do test for the things like lead on,
Mhm.
maybe not on all of them, but some, and they're not able to test every brand on each supplement, but they do some. And so it's a good place to go to find out if they have if something you're taking has too much lead, if that's one that they analyzed, and maybe you'd want to switch to one that they did analyze. They test for, does it have in it what it says it has in it? And
Mhm.
yeah, it's a good website, and you can get some information for free. It cost me about $30 a year to use it, but I've appreciated the
Now,
ability
have you found one particular brand that has always gotten high ratings?
No. So it's yeah, there's one brand might have a high rating, or approved or not approved is what they would say, and on something, and a lower rating on something else. So it would be better not to assume that the brand you're taking is great.
Yeah, that's a good point. So
Yeah,
maybe people want to use that, but my feeling is you should try to take a minimal amount of vitamins and focus more on,
yeah,
your diet and nutrition.
yeah. But then the ozone eye machine, and I'm using that, but I when I put the drops in my eyes, they burn. That not for a long time, but it does burn to put that in there. And I'm using the saline that I got from you. So does that matter?
No, it's not unusual for it to burn. That has to do
Uh-huh.
with the osmolarity and maybe the pH of your body. If it
Uh-huh.
burns and you would develop redness afterwards, then I would be concerned.
Yeah.
But if it burns when it just goes in and the burning stops after a couple of seconds or minutes, I think that's fine.
Okay. All right. Well, I think that's all I've got for right
Okay,
now.
good.
Yeah.
Okay, let's see. Elaine, how are you?
I'm still kicking, thank you. I have a question about the microcurrent. Which plan has the weakest current in it? Is it the
Which program?
which program?
Yeah, the I program, we have 20 microamps. The rest of the programs range between 40 to 100.
Okay, I had such problems with working with it that I thought I'd try the weakest program on a shorter period, and I didn't know which one to use.
Yeah, well, the I has the lowest current.
That's the one I'll try to work with then.
Yeah. And if you want to experiment with it because you're sensitive, you just may want to run it, on your hands, just holding the gloves in your hand.
That's what I was doing, either on my feet or my hands, it would work.
But interestingly, even if you would run the eye microcurrent holding it in your hands, you're still getting some effect in your eye because of the vibration, the frequency. But of course, the best way to do the eye is with the washcloth over the eye and behind the neck.
Being that I had neuropathy, if I used it on the feet, would that still help the eyes?
A minimal amount.
Okay. Better
Minimal
on the
amount.
hands. Okay.
Yeah.
And the other question is, I can't, I was trying to remember which homeopathic remedy I was on, but I was just wondering if it would have any effect on making the skin more tender. And it seems like I'm having a lot of problems with the ligaments and things like that this last couple of weeks.
Yeah, if it's a new symptom and you never had it before, then we probably have to talk about it. So you may want to talk to Chris and we'll schedule a session to review these things.
All right, thank you.
All right. Okay, you take care. Hang in there. Tyra, hi, I can't see you.
Hi, okay, let me
Tyra
see if I can
Bloom?
get, yes, how, can you hear me?
I can hear you, but you were on. I saw you a moment. It
Yeah,
was
now I got,
flickering
I
and
think, now I got it back.
yeah, but now I just see your ceiling fan. I don't see you. Okay, there you are.
Okay, my question is regarding taking the, EDTA for the chelation test. I just recently was, actually hospitalized overnight for, low sodium. And now I'm trying to get that back okay. So how, when would it be safe for me to do the test?
Well, the chelation, the pills you're taking should not adversely affect the sodium, but we should be careful. Let's
Right.
wait till you get your electrolytes back to normal
Okay.
and make sure you're properly hydrated. What was the cause of the low sodium? Is it some medication you're taking or?
Yeah, from some medication. Yeah.
Yeah, so you may want to talk to the doctor about that.
Okay.
And let's
Thank you.
wait until your electrolytes are balanced before you do the chelation test, the urine test, okay?
Okay. Thank you. That was all I had.
Okay, thank you.
Mm.
Okay, Sue Clary, hi. I see your
Hi.
hand.
I just tried this past week I started on the oral EDTA. I actually went to a chiropractor for an adjustment and he looked at the bottle of the garlic one I ordered and he recommended one he carried. So, and he does nutrition work even though I don't go to him for nutrition. He gave me one, like 6 a day, 3 like breakfast and 3 at dinner, and then a binder at night at bedtime. So I just had and ordered his because he looked at the ingredients and he felt his was even better.
How many milligrams of EDTA is in his bottle?
I don't know. I could go grab them quick.
Yeah,
You
maybe
wanna-
grab it quick because
Hang
the
on.
EDTA is the key ingredient. So while Sue's getting that bottle, if somebody else has a question. I mean, there's a lot of different products for chelation. The key ingredient is the EDTA. That's what I'd be curious to see. Hey, Jean, I think your hand was up slightly.
Okay, I'm unmuted.
Yep, you're unmuted. As soon as I'm
Okay.
done with you, Sue, when I'm done with Jean, I'll go back to you, Sue.
Okay.
What my question was, the progression of homeopathics. It goes from the cure would go from the inside out.
Yes.
Is that correct? So lately I have found that I seem to have a skin rash. So do you think that would be a good sign?
Well, when I was studying homeopathy, we were taught if you get a skin rash after taking a homeopathic remedy, that's a reason to celebrate.
Okay, so yeah.
Because the body heals from inside out. The important thing is when you do get a skin rash, make sure you don't use steroid cream or something like that to push it back into your body.
Oh, okay, right.
So you want to maybe treat it with calendula ointment.
Yes, I have
calendula.
Some of that. Yeah.
Calendula ointment or just some compresses, but don't use any steroids to push it back in.
Oh, okay. That's good. I think I put some Benadryl on it last night because it was driving me crazy, but I guess maybe I shouldn't have done that. So I won't do that again. I'll use the calendula. All right. Yeah, that was my main thing, but I was thinking.
Okay, well, a skin rash is a reason to celebrate.
Yeah. Okay. Well, that's good. I'm happy about that.
Okay, we'll celebrate. We're going to celebrate with you.
Okay.
All right. Okay, Sue, you have the ingredients. How much EDTA?
Well, actually, there's no EDTA in either of these.
Yeah, I
So
don't
it's
like
called
the product.
G-Cell and Bind. And I told him about the lead and I said EDTA and I showed him the bottle of the garlic one. So now I'm like, there's not a single there's tons of ingredients, but not EDTA.
Yeah, so I don't like it. I don't like it at all.
Well, I have the garlic.
EDTA is the key. And I'm not alone. You know, all the top doctors who do work with chelation of heavy metals recommend EDTA.
I agree, because I follow this one doctor and he totally talks about that. Anyhow, so I tried the suppository for the first time last night, but I had kind of like pain from it. Is that, I don't know why, but I literally had to get up after not even 5 minutes and just get it out. It was
Now,
like,
was it pain or just the urge to defecate?
it was more than that. It was more like an unpleasant, uncomfortable, I don't know, just kind of like pain.
Yeah, well,
wasn't-
that's not unusual. When I do the rectal, I do feel uncomfortable. And
Oh,
it's the timing of the rectal suppository. You want to make sure that you have a good bowel movement before you do it.
well,
Also, you might want to experiment. Some people have less symptoms if they keep the suppository in the refrigerator or the freezer.
okay. I
So
called the company. He told me
experiment
to,
with temperature.
okay. I just figured I'd just keep trying. And I also had just finished a week ago, like a colon cleanse that was like a 6-day colon cleanse. And then I actually just finished a liver cleanse, which really flushes your system too. So I don't know if that was because I was more sensitive from doing those. So I'll
Yeah,
just
I
give
think that may
myself,
be it. You're just doing too much with your colon.
I think that's part of it. Like I need to give myself a little more rest time. And then
Yeah,
hopefully,
wait till it to settle down and then try another suppository. Experiment with the temperature.
okay.
But some people just can't use the suppository,
Oh,
unfortunately, and they just want to stick with the oral.
okay. Otherwise, is there an email that goes directly to you that I can forward all
Yep,
those supplements I'm on?
the info goes to all of us. Info goes to Chris. It goes to me. It goes to my wife. Everybody gets it.
info@healingtheeye.com.
Yeah.
Okay,
And then
because
usually Chris will bring it to my attention. I talk to Chris every day. And I usually talk to my wife every day too. So they're on top of things.
okay. And then that Dr. John that I'm trying to get you to be able to talk to, he's on spring break. So hopefully next week when he's back or this week, I can
Yeah, I'll
get some
make time for
success.
him.
Yeah. So hopefully that we'll have a breakthrough with that finally.
Now, is it better for him in the morning? Is that the time for him?
I think he said the only time he had was like 6 to 7 in the morning. But he didn't
That will actually work out because I'm heading to Europe and Africa. Right now I'm at the airport. So I'll be 6 hours ahead. What time zone are you?
Eastern, Michigan.
Okay, yeah, six in the morning would be noon in Africa.
Oh,
So
okay.
that may work out. So try to coordinate things with Chris.
I'm going to call their office directly Monday morning just to try to get his attention more because he didn't respond to my email still either.
Mm.
And
But anyway,
then
for all of you, I'm more than happy to talk to your naturopathic doctor, alternative doctor, so we're on the same page.
okay, well, the one I just got this from, he's also a naturopathic that does nutrition, but I don't go to him for my nutrition. However, he's got light therapy. I showed him my microcurrent and he's studying to become a neurologist. But I mentioned this to Chris that he suggested me coming back and trying to help me also. But Chris said I should wait at least 3 months before adding anything else on.
When you join my program, stick with it for 3 months. I'm not against other treatments, but as soon as you start mixing, it really upsets me when somebody starts the program and they get a new device or they started a new nutritional plan, and then it's confusing. I don't know if it's what I started is causing the problem or something else. I think we have a very good program that worked for a lot of people. So just stick with the protocol that I give you for 3 months. Now, if you're doing something on a regular basis. Let's say you're getting chiropractic manipulation or getting a massage, you're getting acupuncture treatment every week. Continue it. Don't stop it, but just don't do anything new. Does that make sense?
Yeah. Okay, thank you. That's all I have.
Okay, thank you. Okay, we have Jennifer. Hi, Jennifer.
Hi, Dr.
How are you
Kondrot.
doing?
I've just, a lot has been, my priorities had to shift to my knees because that was really creating a lot of problem. So I've actually had a lot of appointments with the doctors related to my knees. But I did start doing the microcurrent more on them with the inflammation protocol and the osteoporosis protocol. Even though the bone isn't fractured, I thought, well, maybe it might help heal the bone, since the bone is leaking blood, is what they told me. So it's been 3.5 months since the original injury. So I've been kind of working that, because having good knees is very important, especially in New England when we're having nor'easters in April.
Yeah,
And
you have to be able to run.
Yeah,
handle
I
the
get up
storm.
22 stairs to get to my front door. Yeah, the run is coming up too, right? I wish I could do
Well,
that.
is the microcurrent helping your knee?
I want to say it is. I do feel like I mean, I'm fortunate. I mean, I think it's, I don't have pain, outside of when I'm trying to raise or lower myself from the floor. I don't have pain, and I don't have huge inflammation, even though there is some edema that was picked up on the MRI. So, I feel lucky that this has helped in that degree. I did add magnets to the at 3 acupuncture points around the kneecap, to try to help to move the blood a little bit more throughout the day. So I'm doing the microcurrent at intervals during the day, and then I can keep the magnets on there to keep things moving, throughout the day. So
Well, you can do the microcurrent for a longer period of time. You could use the knee pad or the pads and run the program 2 or 3 times a day.
Right. Yeah. So I'm doing it more times per day, but sometimes that's not always reasonable, because the unfortunate thing for my situation with all of my health issues is the amount of chaos and in my life, and there are so many things I have to do. I can't sit still for any length of time.
Yeah, well, it sounds to me like you need to do the stress program.
And I did add that, and I did find that at least was keeping me kind of grounded, because I was in a bit of a panic when they told me that the bones were still leaking blood 3.5 months later. So that's,
Yeah, and also the brain program and the stress program go hand in hand.
the brain and the stress. Okay. I do the eye and the brain every day. I do the eye and the brain memory. That I do every day. And then I've kind of gotten a little haphazard with whether I do detox and adrenals or inflammation and cervical, because I have a lot of issues in the cervical spine. So I've kind of, if I have a good day where I can be still for a good chunk of the day, I can do more programs. But due to the kind of responsibilities and deadlines I have, I haven't been able to. But I'm doing my best with that. And when I'm not using microcurrent, I just started putting magnets on the knees just to kind of continue keeping
Well,
it
anyway,
going.
just to inform you, I'm an eye doctor, not a knee doctor. So we want to hear about your eye.
No,
How's your
I
eye
know.
doing?
So the question I have a question with the eye program. I am noticing, I didn't pick up on it initially, but when I have the washcloth over my eyes to do the eye program, I'm finding that sometimes I know you said to keep your eyelids closed. Sometimes though, I find myself opening my eyelids, and I just want to know, does that cause damage by keeping the eyelids open? Because I think sometimes
No, it's
my
the
mind
concern is that you may open the eyes in the washcloth, or some of the water may get into your eyes and cause an irritation. So it's best to keep your eyes closed.
Okay, so it has no impact. The current has no impact. Eye open or eye closed. Well,
No,
impact eye.
but you do want
Okay.
that current to flow through the closed eyelid. If it's open, there's no contact with the ball of your eye, the cornea. So you want to keep your eyes closed. You want is
Oh,
up
it has
against the closed
contact.
lid. Yeah,
Oh, so when your eyes open,
that's
it's
the
not
key
going.
area. That's the key area for your retina and for your macula.
Okay, I gotcha. Okay, that makes sense. Then I don't realize sometimes when I'm doing it because my brain is just, when I'm laying down, I got the monkey mind, I'm thinking of all the
Yeah.
things I need to do or haven't done and stuff. So, and my eyes
Well, you just
automatically
have to
come down.
maybe meditate, some deep breathing, positive affirmations, prayer. Keep
Yes,
your mind away from the monkey mind. Keep your
yeah,
mind focused on something positive.
yes.
All right.
Okay, thank you.
Thank you. Okay, Renee, you have another question? Renee, you have to unmute.
Yes, I just have a suggestion, and I missed your meeting 2 weeks ago. I was away, and I heard Jennifer talk about her knee then, and when I watched the replay, Jennifer, I was like, I wish I could get a hold of her. So on Wednesday with Chris, I did give this information to Chris, but what it is a therapy called soft wave tissue regeneration technology, and it's totally non-invasive. People who have bone-on-bone knees and other joint problems are avoiding surgery. What this does, it's kind of like an ultrasound under pressure, and after they use it on your joint or whatever part of your body, it's like honey, it's like bees being drawn to honey. It's your cell stems that are drawn to that area, and it increases the blood circulation. It heals wounds. It regenerates your knee joint or your shoulder or hip or whatever. And I gave Chris the website so that if anybody contacted her, they
Oh,
could
Renee,
get a,
send the website to info, and then when I post a recording to the group, I'll have that
okay.
website.
Okay,
But
and
that's
on this,
great that you're thinking of Jennifer.
yeah, and anybody that has, it also is, I had peripheral nerve damage in my shoulder at one point. I couldn't raise my arm very high at all, and I had that treatment done, and it's perfectly normal now. But it's just good to know that there are alternatives to something that's really invasive, and um, it's the cost is not like some of this other regeneration stuff you hear about. And there's not even an injection involved. It's totally non-invasive. So yeah, I'll send that to you.
Oh, also, it's an injection, but the ozone injection works miracles. Many alternative doctors that I know will inject ozone in the joint,
Yeah.
and that's a miraculous cure. But of course, that's an injection, and I agree with Renee. You may want to try something a little bit more non-invasive. I think it depends on the cost.
Yeah.
Okay, Elaine.
And that was soft
Another.
wave. What was it? Soft wave.
We'll
Soft.
send you the link.
Yeah. And I can just
Look
say
for
it right
the
now too, if you want to write it down. It's softwavetrt.com. And you can find people in Massachusetts and New England, because I live in New England also.
Okay, Elaine, you have a question?
Yes, I just thought of it and I heard everybody talking about something. I have what they told me, my thumb has a trigger finger and they're talking about steroid injections. Now that would be bad for my macular degeneration, wouldn't it?
Well, a small steroid injection in the joint may not affect the eye, but I tend to avoid steroids at all cost because it can cause cataracts, glaucoma, and diabetes. I would much rather see you try an alternative treatment like the microcurrent, or do an ozone injection, or do the treatment that Renee was talking about.
Okay.
But
Yeah.
I usually, you want to try to avoid steroids.
Yeah,
Steroids go against homeopathic principles. Homeopathic doctor shudders every time he hears a patient using steroids. It's anti-homeopathic.
Well, I'm a little bit allergic to some steroids, so I'm afraid to take it. And
Yeah, that's another reason.
yes. So I had therapy and none of it helps. So they're kind of, if I had a topical steroid on that area, that's not good either, right?
Not good either.
Okay.
No.
Thank you. So I've been refusing. I just wanted to make sure it wasn't a mistake.
No, it's not a mistake. Bonnie, your hands up again?
Yes, you mentioned seed oils. What about seeds themselves, just eating seeds?
I think that will be all right. It's the seed oils.
The oils, okay. And
it's in concentration, and also the way they process it too.
yeah. Okay, then the homeopathic, I'm going out of town in May for a couple of weeks, and I don't want to take that liquid homeopathic with me.
And
Should
why
I
don't
just
you?
go? Well, I don't check a bag. I try to keep it as small as possible. And I'm just, I could put it in there, but it's, it's,
No, I travel with my homeopathic remedies all the time.
yeah.
I
Okay.
travel with 50 remedies. Because wherever I go, I want to make sure I have those remedies to help people.
Okay. Well, then in the gym where I go, they have a red light machine. And they say it won't harm your eyes. I do get in that machine, but I made myself a pair of like black felt covers that cover both my eyes when I'm in there, because I'm not sure I trust the machine or what
Now,
they
is this
say.
a machine? Is this a machine for detoxification?
There's a whole list of things. Red light therapy is quite common now, especially here in Sedona.
No, red light therapy, it can be good for the eyes, but you don't want the red light going directly into the eye. You want to protect your eyes.
So the fact that I'm putting the felt over my eyes and keeping them closed in there is probably a good thing, right?
Yeah, I agree. Definitely.
Okay. I'll keep that up. Thank you. That's it.
Okay, let's see. I moved my hand and I was going to ask myself, do you have a question, Dr. Kondrot? I'm looking for everybody's hand. Vivian, okay.
Okay, two things. What was the name of the thing for, was it Ocuflorin for macular degeneration? Ocufolin. And is that available readily, or we get that through you?
Yeah,
or?
you need a prescription for it.
Okay.
You can call Chris. That's a product that's part of our program, the Ocufolin.
Okay. Then
And
the other
I've really
thing
been
is,
impressed. I've really been impressed with the Ocufolin.
There's a picture
that
of it.
helps macular degeneration.
Oh yeah, there's studies done. Oh, and interestingly, I take 4 capsules a day myself, not because I have macular. I have an enlarged prostate. And I'll tell you what, the Ocufolin just quieted my prostate.
No surgery for you. Yay.
No surgery for me. Nope.
Yay. The other thing is something I found that's very helpful with the machine, the microcurrent machine. Most washcloths are too big for the gloves. So I went to TJ Maxx and I bought baby washcloths, and they're perfect size, and they don't, they're not flopping over onto your hair. So if anybody else is finding their washcloths too big, get baby washcloths. Any place that has like a baby department for showers and stuff will have
Well,
a baby.
I like Walmart washcloths.
They're thin.
Well, you want them thin. You don't want them real thick. I
Yes.
like the
Yes, I
Walmart
like
washcloth.
thin. I bought a bunch of bamboo ones at a flea market once, and they're great too. They're very thin and they're a little smaller.
Well, I don't know about the bamboo. I don't know if the bamboo is a good conductor,
Oh, cotton is.
because bamboo is like wood, and it may be an
Oh,
insulator, not a conductor. So I would not use
oh,
bamboo.
okay. I'll switch
Use
back to the cotton. The ones I got were organic cotton baby washcloths, $1
maybe you could send
piece.
me a link, and I can put that in the email when I send out the recording. Okay.
Oh, okay.
Okay. I think Lois, you're showing off your pad again. I can't hear you, Lois.
Okay, there. Sorry, I couldn't get the button to unmute. Yeah. Well, I always put it on when I'm sitting down. So yeah, I'm on the stress program right now. I've run it 3 times. Yeah, a couple questions just came up for me. I'm still most of the time I still can't take the full number of Ocufolin capsules a day because they just seem to irritate my stomach and they give me a slight headache. And also the ocular spray. Like I took it today after lunch, and I don't feel good when I take it. And I do have a lot of not exactly allergies, but I do have a lot of food sensitivities and things that I avoid. And you said earlier how important the Ocufolin is, and it's kind of tough because I really want to follow the program as much as I can, but sometimes most of the time when I take the supplements I don't feel good. So it's been that way for several months, so I just don't know quite exactly what I should do about that. Just continue to tough it out as best I can, or
Well, maybe reduce the dose, and don't forget you're taking the homeopathic remedy, which may strengthen your body, make
okay.
your body stronger and be able to tolerate.
Yeah, well, I'm not on a remedy right now because I wasn't doing well on the lachesis, and that's one of the things that I need to talk to you about when we have our consultation. My other concern is too, when you were talking about the steroids, does that also apply? I'm on, unfortunately, in the last few months, my from a year and a half ago, my emphysema, although I never smoked or anything, has gone from mild to severe. And I'm on Symbicort, which is, a small inhaled steroid, and I've been on it for a long time. And I've tried a few times not to take it, but I get into trouble if I don't take it. And so I just don't know what I can do.
Well, you need to avoid the steroids, but then, if it's a breathing problem, you may be forced to take it. That's why we got to look at a good homeopathic for you, because the homeopathic will treat not only your eye problem, but your lungs and other issues too.
Okay, good.
So we have to work on a remedy for you.
Okay, good. All right, that's good to know. Thank you.
Okay, Jennifer?
Yes.
Hi, Jennifer.
My question is in response to your talking about not doing anything for 3 months once you've started the program. And I agree wholeheartedly.
Nothing new. If you're
okay, so let me ask you this. So I have hypothyroidism and I'm taking medication, but I'm symptomatic and my numbers are kind of low. So I have an appointment with an endocrinologist in a couple weeks, and I wonder if I should go through with that and perhaps change my thyroid medication when I've just started the program.
That might be an issue. We just have to follow it carefully. if you decrease the thyroid medication and all of a sudden you become tired and you develop other symptoms, I'm not going to know whether it's because you're decreasing the thyroid.
Right. Well, I kind of doubt he'll decrease it because I'm symptomatic. I'm afraid he might want to increase it or change it.
No, I would wait. I would not change it at all. And let's see how the program may help your thyroid.
Okay, so wait. Okay.
I would hold off on that.
Okay.
All right.
Should I I have, as one of my optional programs, I have the thyroid program. Should I start using that as priority?
Oh yeah, definitely.
Okay.
Definitely.
All right.
And see if that helps.
Okay, thank you.
Okay, one more question, because we're coming to a close here. And Barbara,
Can you,
Okay,
Barbara?
I just unmuted. Can you hear me?
Yep, I hear you fine.
I'm just getting into the program and I wanted to check, since I've had some digestive issues for a while, are any of these supplements going to impact my digestive system, or should I start slower rather than?
I would start slower, listen to your body. If you're sensitive, just maybe start out with one capsule of the ocufolin, see how
Okay.
you tolerate it.
Okay.
Oh, and I just programmed your machine today.
Oh, wow. Thank you.
Right before this meeting, I wrote all the frequencies for your machine, so it's on its way.
Yay. I'm very excited.
Yeah, keep us posted.
I will be glad to do that. I did get the eye drops that I ordered, and I started those. I'm going to do like 1 drop a day for a couple of days and see how it goes, and then increase it to 2, and then
Good.
to 3.
Okay. Okay, well, thanks everyone. I'm happy that you joined the meeting, and we'll be having another meeting in 2 weeks. Okay, in the meantime, any questions, make sure you pass them on to Chris.
just real,
Remember,
okay.
I talk to Chris every day. She gets me updated on other situations. Okay, so everybody have a good weekend. Thank you very much.
What time is the meeting in 2 weeks?
The same time, 2 o'clock.
2 o'clock? Okay.
We're trying to
Thank
keep
you.
it at 2 o'clock on Saturday. Okay.
Okay, good. Thank you.
Bye, everybody.
Bye.
Bye.